I will discuss the links between anxiety, depression, and social media usage among adolescents. I chose this topic because I feel that the youth are very important. I also feel that technology does play a huge part in today's society. In research, questions have been raised about whether adolescents do experience anxiety and depression while using social media sites. When we talk about adolescence, there are three stages, which are early, middle, and late stage. The early stage is ages between 10 to 14 years old. The middle is 15 to 17 years old. And the late stage is 18 to 24 years old. Next, we will discuss the new norm. What is the new norm? The new norm is using technology to access social media. So you have these devices like your cell phone, iPad, tablet, smart television, smart wearable watch, and your computer. Now you can access these popular websites like Facebook, Twitter, Instagram, YouTube, TikTok is a big one, and Snapchat. Next, we will talk about what is social media. Social media is a huge platform. It's an electronic communication that you can connect with your family and friends. You can promote and share your ideas and your talents. Everyone is on there, so it's complimentary for everyone. You can create and edit your comments and posts. In the year 2013, 94% of US teens reported having a Facebook account, and they spent an average of 9 hours a day using the sites. Next, we will talk about the pros and cons of using social media. So, what's good? What's good and bad about social media? Well, one good thing about social media is you can maintain friendships. A lot of people use it for entertainment. You can practice your social skills. You can share your feelings. You can stay connected. You can stay updated with the latest news. So, what's bad about social media is you can experience cyberbullying. You can experience low self esteem, lonesomeness. A huge one is you can experience fear of missing out. Social media can become obsessive. So you can, a lot of people do this. They go on, they actually check their phones like every minute to 5 minutes and go on the site just to make sure they haven't missed out on anything. Next, we're going to talk about anxiety. What is anxiety? Anxiety is an emotion that we experience. It's a mental health disorder. Anxiety is the most common psychological disorder in adolescence, and it does have a negative effect. So there are six major types of anxiety disorders, which are generalized anxiety, obsessive compulsive disorder, phobias, social anxiety, panic disorder, and post-traumatic stress disorder. Next, we are going to talk about the symptoms and signs of anxiety. You can experience panic attacks. You tend to worry. You tend to become anxious. You're fearful. You're unable to concentrate. You can you can show aggression, and you can also get depression. Well, we're on depression. We're going to talk about depression next. So, what is depression? Depression is a disorder that can affect an individual's mood. So you can feel guilt. You do feel sad. You feel hopeless. You feel worthless. You may sleep too much or too little. And you can pretty much not like yourself. So what are the results? So yes, you can experience anxiety and depression while using social media sites. Social media can become obsessive, and it can increase your anxiety. Some studies have confirmed that those who do use social media do get depressed frequently when they only get a few likes on their posts. When you do post about your feelings, well, if you do post and vent on social media, it can change your mood swings and cause you to have low self-esteem. The adolescent population is at a higher risk of negative consequences of social media due to teens' vulnerability to peer pressure and reduced ability for self-regulation. Next, we're going to discuss guidance for reducing the amount of time spent on social media to avoid experiencing anxiety and depression. Okay, for one, we need some sort of parental control. We need to limit the amount of time spent on social media. I mean, we could just pretty much stay off social media sites. We can use our leisure skills. Do whatever we like to do. If it's singing, dancing, swimming, fishing, ice skating, we can do that. Next, we're going to talk about treating anxiety and depression. We can get self-help. Well, we can self-help, which is mindfulness. We can meditate. We can seek professional help if it cannot be controlled. Parents, please talk to your child's pediatrician. You can also talk to your primary care doctor. You can seek out for a therapist, and antidepressants can also be described. These are my references, and thank you so very much.